According to the World Health Organization report, over 1.5 billion people have hearing impairment issues, and the situation will be worse in 10 years to come if the root cause to this problem is not addressed, as the world awaits to celebrate the World Hearing Day on Sunday, 3rd March. CKA IHK, in conjunction with Kampala Audiology Speech Center and Medill, have done cochlear implants to patients with hearing impairment at IHK Hospital.
It's important to screen, to find patients, to select them properly. Then, of course, the surgery is a main part, but also post-operative, the treatment is very important, the fitting and the follow-up.
Fiona Kamya, a specialist in audiology, highlighted some of the major causes of hearing loss and how it can be avoided.
Of course, newborn children, we need to be sure you're okay immediately you're born. So we'll do a screen for you immediately you're born. But when you talk about noise in particular, the susceptible people we see are those who are exposed to loud sound. By noise, we mean loud sound. We are now seeing a lot of leisure use of noise, earphones and music, personal devices. So we do it. 1, screening. 2, legislation. Don't have a phone which doesn't tell you how many decibels you're being exposed.
Doctors say though some causes of hearing loss can be addressed or avoided, reluctance to go for regular checkups has worsened the challenge at hand.
The journey starts, I give an example of a child who is born without hearing. Most parents will only realize this at 2 years, 3 years, that the child is not responding. That's a bit late. So right now we are encouraging that every child who is born, let their ear be screened and find out if there's hearing loss. It's a whole journey for these children. So we are happy that even with CKA here, we are now able to screen.
So far, IHK Hospital, in conjunction with other hospitals, have done 34 successful cochlear implants surgeries.
CKA IMCs, that's 20 clinics distributed across the country that are able to ensure that we reach a very huge population and be able to avert most of this burden before we have to reach to the point of cochlear transplant.
With the need to tackle the challenge of hearing impairment at the earliest stage possible, IHK, in conjunction with the government, engaged in a pilot project to scan newborn babies in different hospitals across the country.
In 4 hospitals in the country, one in Mbarara Regional Hospital, one in Kawempe Women's Hospital, one in Masaka, another in Gulu, another one Gulu. So children who are actually born can be screened at birth, and then if the child fails, they are followed up after 2 weeks, and by the time they are 6 months, we have a concrete diagnosis of what the child is having.
The World Hearing Day 2024 will be held another theme, changing mindsets. Let's make ear and hearing care a reality for all. Deborah Namamonde, UBC News.